What if I told you that the way you're sleeping tonight could be silently increasing your risk of having a stroke before morning? I know that sounds alarming, but listen to this. Cardiac surgeons are now warning that one common sleeping position, one that millions of Americans use every single night, may be restricting blood flow to your brain while you sleep. And here's what's even more concerning. If you're over 60, this risk increases dramatically. Margaret, a 67-year-old grandmother from Ohio, went to bed feeling perfectly fine one Tuesday evening. By Wednesday morning, half her face was drooping and she couldn't lift her right arm. The culprit? Not just her underlying health conditions, but the sleeping position she'd been using for decades. Stay with me for the next few minutes because what you're about to learn could literally save your life or the life of someone you love. Hello friends, if you're watching this video, chances are you're over 60 or you care deeply about someone who is, and that tells me something important about you. You're someone who takes health seriously. You're not waiting for problems to happen, you're trying to prevent them. That's exactly the kind of wisdom that can add not just years to your life, but life to your years. Today we're diving deep into something that affects every single one of us: sleep. More specifically, we're talking about sleeping positions and their connection to stroke risk. Now I know what you might be thinking. I've been sleeping the same way for 40 years. How could it suddenly be dangerous? Well, the truth is, our bodies change as we age, and what worked fine at 30 or 40 can become risky at 60, 70, or beyond. According to the American Heart Association, someone in the United States has a stroke every 40 seconds, and for those over 60, the risk doubles with each passing decade. But here's the good news: many strokes are preventable. And sometimes, prevention can be as simple as changing the way you position yourself when you sleep. So let's talk about what leading cardiac surgeons are warning us about, and more importantly, what we can do about it tonight. Let me get straight to the point. The sleeping position that's causing the most concern among cardiovascular experts is sleeping flat on your stomach, also known as the prone position. Now you might be wondering, why is stomach sleeping such a problem? Let me explain this in simple terms. When you sleep on your stomach, several things happen to your body that you probably never think about. First, your neck is forced to turn at a sharp angle, usually 90 degrees or close to it, to one side. You have to do this just to breathe, right? You can't exactly sleep face down into your pillow all night. Here's where the danger comes in. Running through your neck are two critical arteries called the vertebral arteries. These arteries are like highways that carry oxygen-rich blood directly to your brain. When you twist your neck to the side for hours at a time, especially in the extreme position that stomach sleeping requires, you can compress these arteries. It's like putting a kink in a garden hose. The water flow becomes restricted. Dr. Robert Henderson, a cardiac surgeon with over 30 years of experience, puts it this way: when the vertebral arteries are compressed for extended periods, the blood flow to the posterior part of the brain can be significantly reduced. For younger people with healthy, flexible blood vessels, this might cause nothing more than some neck stiffness. But for someone over 60, whose arteries may already have some plaque buildup or reduced flexibility, this compression can be the trigger that leads to a stroke. Now, let me explain what plaque buildup is, because this is crucial to understanding your risk. As we age, many of us develop atherosclerosis. That's when fatty deposits, cholesterol, and other substances build up inside our arteries, making them narrower and less flexible. Think of it like old pipes in a house that have mineral deposits built up inside them. The water can still flow, but not as freely as it once did. When you combine narrowed arteries with a sleeping position that further restricts blood flow, you're creating what doctors call a perfect storm for stroke risk. But there's another problem with stomach sleeping that affects your stroke risk. It can significantly raise your blood pressure during the night. When you sleep on your stomach, you're also putting pressure on your chest and lungs, which can make breathing more difficult. Your body has to work harder to get oxygen, and this can cause your blood pressure to rise. High blood pressure during sleep is particularly dangerous because that's when your body is supposed to be resting and recovering. If your blood pressure stays elevated all night, you're putting constant stress on your cardiovascular system. And if you already have high blood pressure, which affects about 2/3 of Americans over 60, sleeping on your stomach can push your numbers even higher into the danger zone. And spew. Let me take a moment here to explain why this issue is particularly critical if you're over 60. Your body at 65 is not the same as it was at 35, and that's not a criticism. It's just a fact of life. Our blood vessels naturally become less elastic as we age. They don't expand and contract as easily as they once did. This is why blood pressure tends to increase with age, even if you haven't changed your diet or lifestyle. Additionally, many seniors are dealing with what we call silent cardiovascular issues. You might feel fine, have good energy, and go about your daily activities without any problems. But beneath the surface, you might have partial blockages in your arteries that haven't caused symptoms yet, early-stage atrial fibrillation, an irregular heartbeat that increases clot formation, thickening of the blood vessel walls, reduced blood oxygen levels, or sleep apnea that you're not even aware of. Any one of these conditions, combined with a sleeping position that restricts blood flow to the brain, can dramatically increase your stroke risk. Think of it this way. If you're driving a car that's in perfect condition on a perfectly maintained road, you can probably handle a few bumps without any problem. But if the car already has some wear and tear, and the road is already rough, adding more bumps becomes genuinely dangerous. That's exactly what's happening when you combine age-related cardiovascular changes with stomach sleeping. I also want to mention something that many people don't realize. Strokes that happen during sleep or immediately upon waking are particularly dangerous. Why? Because the longer a stroke goes untreated, the more brain damage occurs. There's a saying in emergency medicine, time is brain. Every minute that passes during a stroke, nearly 2 million brain cells die. If you have a stroke in the middle of the night while you're sleeping, you might not get help until morning, and by then, hours have passed. This is why prevention is so absolutely critical. Now I want to pause here for just a moment and ask you something important. If you're over 60 or if you're caring for an elderly loved one, this information could be genuinely life-saving. And I mean that literally, not as some kind of exaggeration. So I'd like to ask you to do two things. First, if you haven't already, please subscribe to this channel and turn on notifications. We share practical, research-based health information specifically for seniors every single week, and I don't want you to miss out on information that could protect your health. Second, think about sharing this video with your family members, your children, your siblings, your friends. Stroke prevention is something that benefits from having a support system, and the people who love you need to know this information too. All right, let's continue. Now that you understand the risks, let's talk about solutions. What are the safest sleeping positions, especially for those of us over 60? The gold standard, according to most cardiac surgeons and sleep specialists, is sleeping on your back. This is also called the supine position. When you sleep on your back, your spine stays in a neutral alignment, and your neck isn't twisted to either side. This means your vertebral arteries remain open and unrestricted, allowing maximum blood flow to your brain throughout the night. Back sleeping also promotes better breathing because there's no pressure on your chest or lungs. This can help keep your blood pressure stable during sleep and ensure your brain is getting plenty of oxygen. However, there's an important modification I need to tell you about. Don't sleep completely flat. Elevating your head and upper body slightly, about 15 to 30 degrees, is ideal for most seniors. Why? Because slight elevation helps in several ways. It reduces the risk of acid reflux, which is common in older adults. It can help reduce snoring and sleep apnea symptoms. It promotes better circulation, and it reduces pressure on your heart. You can achieve this elevation by using a wedge pillow specifically designed for this purpose, or by adjusting your bed if you have an adjustable base. Don't just pile up regular pillows, as they tend to shift during the night and can actually create neck strain. If back sleeping just doesn't work for you, and I understand that for some people it simply isn't comfortable, the next best option is sleeping on your left side. Left side sleeping has some specific cardiovascular benefits that make it preferable to right side sleeping. Here's why. Your heart is positioned slightly to the left side of your chest. When you sleep on your left side, it's easier for your heart to pump blood throughout your body because it's working with gravity rather than against it. Additionally, left side sleeping takes pressure off your inferior vena cava. That's the large vein that carries blood from your lower body back to your heart. For seniors with heart failure or certain heart conditions, doctors often specifically recommend left side sleeping for these very reasons. When sleeping on your left side, make sure you use a pillow that keeps your head and neck aligned with your spine. Consider placing a pillow between your knees to keep your hips aligned, and don't curl up too tightly into a fetal position, as this can restrict breathing. Right side sleeping is still better than stomach sleeping, but it's generally the third choice after back and left side sleeping. Some studies suggest that right side sleeping may slightly increase heartburn symptoms and might put a bit more pressure on your heart. That said, if right side sleeping is the most comfortable position for you and allows you to get quality sleep, it's still acceptable. The most important thing is to avoid stomach sleeping. While we're talking about sleep and stroke risk, I'd be doing you a disservice if I didn't mention a few other sleep-related factors that can significantly increase your risk. First, sleep apnea. This is a big one, and it's incredibly common among seniors. Sleep apnea is a condition where you repeatedly stop breathing for short periods during sleep. These pauses can last from a few seconds to over a minute, and they can happen dozens or even hundreds of times per night. Sleep apnea dramatically increases stroke risk. We're talking about a 2 to 3 times higher risk compared to people without sleep apnea. Why? Because each time you stop breathing, your blood oxygen levels drop and your blood pressure spikes. It's like putting your cardiovascular system through a stress test all night long, every single night. Here are the warning signs of sleep apnea. Loud snoring, especially with pauses or gasping sounds, waking up frequently during the night, morning headaches, excessive daytime sleepiness even after a full night's sleep, difficulty concentrating or memory problems, and waking up with a dry mouth or sore throat. If any of these sound familiar, please talk to your doctor about getting a sleep study. Sleep apnea is very treatable with devices like CPAP machines, oral appliances, or sometimes simple lifestyle changes. And here's something important. Stomach sleeping can actually make sleep apnea worse because of the pressure it puts on your airways and chest. Next, sleep duration. Both too little and too much sleep can increase stroke risk. Research shows that seniors who consistently sleep less than 6 hours or more than 9 hours per night have a higher risk of stroke compared to those who get 7 to 8 hours. I know sleep can become more challenging as we age. Many seniors tell me they wake up multiple times during the night or have trouble falling asleep in the first place. If this is you, there are strategies that can help, which I'll touch on in a moment. Finally, sleep quality. It's not just about how long you sleep, but how well you sleep. If you're tossing and turning all night, never reaching deep sleep, your body and brain aren't getting the restoration they need. Poor sleep quality can contribute to high blood pressure, inflammation, and increased stress hormones, all of which elevate stroke risk. Now, I know what many of you might be thinking. This all sounds great, but I've been sleeping on my stomach for 50 years. How am I supposed to change that now? I hear you. Changing a lifetime habit isn't easy, but it's absolutely possible, and the potential benefit, reducing your stroke risk, makes it worth the effort. Here are some practical strategies that have worked for many of my viewers. Strategy number 1, the pillow barrier method. If you're a stomach sleeper, try placing a firm pillow on each side of your body when you lie on your back. This creates a physical barrier that makes it harder to roll onto your stomach during the night. You might still try to turn, but the pillows will remind your sleeping brain to stay put. Strategy number 2, the tennis ball technique. This is an old trick that actually works. Sew a tennis ball or two into the front of an old t-shirt, then wear that shirt to bed. If you try to roll onto your stomach during the night, the discomfort from the tennis balls will cause you to shift position. It sounds uncomfortable, and it is, slightly, but it works remarkably well for retraining your sleeping habits. Strategy number 3, gradual transition. Don't expect to change overnight. Start by going to sleep on your back or side, even if you know you'll eventually roll to your stomach during the night. Over time, you'll start spending more and more of the night in the better position. Progress, not perfection, is the goal. Strategy number 4, invest in the right equipment. A good quality mattress and pillow can make all the difference. If you're trying to sleep on your back, you need a pillow that supports your neck without pushing your head too far forward. For side sleeping, you need a thicker pillow that fills the space between your ear and shoulder. Consider also getting a wedge pillow or adjustable bed base that allows you to sleep with your upper body slightly elevated. Many people find this position so comfortable that it actually becomes easier than their old sleeping position. Strategy number 5, address underlying reasons for stomach sleeping. Many people sleep on their stomachs because of an underlying issue they're trying to unconsciously solve. For example, if you snore less on your stomach, you might have sleep apnea that needs treatment. If your back hurts less on your stomach, you might need a better mattress or physical therapy. If you breathe easier on your stomach, you might have acid reflux or respiratory issues that need medical attention. Talk to your doctor about these issues rather than just managing symptoms with your sleeping position. Changing your sleeping position is important, but let me give you a few other nighttime strategies that can further reduce your stroke risk. First, stay hydrated, but be smart about timing. Dehydration thickens your blood, which can increase clot formation and stroke risk. Many seniors become mildly dehydrated overnight because they avoid drinking water before bed to prevent nighttime bathroom trips. Here's what I recommend. Drink plenty of water throughout the day, especially in the morning and afternoon. In the evening, have your last glass of water about 2 hours before bed. This gives your body time to process it before you lie down. Second, keep your bedroom cool. The ideal sleeping temperature is between 60 and 67 degrees Fahrenheit. A cooler room helps your body reach the deeper stages of sleep and can help maintain healthy blood pressure levels during the night. Third, avoid late-night heavy meals. Eating a large meal within 3 hours of bedtime can increase blood pressure and make sleep less restful. It can also worsen acid reflux, which might cause you to unconsciously shift to stomach sleeping to find relief. Fourth, manage stress before bed. Chronic stress and anxiety raise blood pressure and increase stroke risk. Develop a calming bedtime routine, maybe some gentle stretching, reading, or listening to soft music. Avoid watching stressful news or getting into difficult conversations in the hour before bed. Fifth, take your medications as prescribed. If you're on blood pressure medication, blood thinners, or other cardiovascular medications, taking them consistently and as prescribed is crucial. Some medications work best when taken at specific times of day. Make sure you know the optimal timing for yours. And finally, consider a bedside water and emergency plan. Keep a glass of water, your phone, and any emergency medications on your nightstand. If you experience any stroke warning signs, you want to be able to call for help immediately without having to search for your phone or walk to another room. I want to spend a few minutes making sure you know how to recognize a stroke, because quick recognition and treatment can make the difference between full recovery and permanent disability. Remember the acronym FAST. F stands for face drooping. Ask the person to smile. Does one side of the face droop or feel numb? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weak? S stands for speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred or strange? T stands for time to call 911. If you observe any of these signs, even if they're temporary, call 911 immediately. Note the time when symptoms first appeared. There are also other warning signs that are important to know. Sudden numbness or weakness, especially on one side of the body. Sudden confusion or trouble understanding others. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, or loss of balance. And sudden severe headache with no known cause. Here's something critical. Some people experience what's called a mini stroke, or TIA, which stands for transient ischemic attack. The symptoms are the same as a stroke, but they resolve on their own within minutes to hours. Some people think, oh, it went away, so I'm fine. But a TIA is actually a major warning sign that a larger stroke may be coming soon. About 1 in 3 people who have a TIA will eventually have a full stroke, and about half of those strokes happen within a year of the TIA. If you experience stroke symptoms that go away, you still need immediate medical attention. Don't wait. Don't sleep on it. Get help. While sleeping position affects everyone, certain factors put some seniors at higher risk for sleep-related strokes. You're at higher risk if you have high blood pressure, especially if it's not well controlled, if you have diabetes, if you have atrial fibrillation or other heart rhythm disorders, if you have high cholesterol, if you've had a previous stroke or TIA, if you have a family history of stroke, if you're a current smoker or former heavy smoker, if you're overweight or obese, if you have sleep apnea, or if you're physically inactive, or if you drink alcohol heavily. If multiple items on this list apply to you, it's even more critical that you pay attention to your sleeping position and overall sleep health. But here's what I want you to remember. Risk factors don't determine your destiny. They're simply information that helps you make better choices. You might not be able to change your age or your genetics, but you absolutely can change your sleeping position, manage your blood pressure, improve your diet, and stay active. I encourage you to have a conversation with your doctor about sleep and stroke risk at your next appointment. Don't assume they'll bring it up. Many doctors are pressed for time and focus on the most obvious issues. You need to advocate for yourself. Here are some questions you might want to ask. Based on my overall health and risk factors, what's my personal risk for stroke? Are there any tests I should have to better understand my cardiovascular health? This might include carotid ultrasound to check for artery blockages, ECG to check your heart rhythm, or a sleep study if sleep apnea is suspected. What's the best sleeping position given my specific health conditions? Should I be taking a daily aspirin or other medications to reduce my stroke risk? Never start taking aspirin daily without medical advice. It's not appropriate for everyone and can have side effects. Are there any warning signs specific to my situation that I should watch for? Also, be honest with your doctor about your sleep quality and habits. If you're waking up tired, snoring loudly, experiencing morning headaches, or having trouble staying awake during the day, these are medical symptoms worth discussing, not just minor annoyances. Let me bring this all together for you. Your sleeping position matters more than you might have realized, especially as you get older. Stomach sleeping can restrict blood flow to your brain, increase blood pressure, and when combined with age-related cardiovascular changes, significantly increase your risk of having a stroke during the night. The good news, and I want to end on good news, is that this is something you can change. Starting tonight, you can begin transitioning to a safer sleeping position. Back sleeping with slight elevation is ideal. Left side sleeping is the next best option. Both are dramatically safer than stomach sleeping for your brain and your heart. Beyond sleeping position, you can improve your sleep quality. Watch for signs of sleep apnea. Stay properly hydrated. Manage stress, and take your medications as prescribed. These aren't complicated interventions. They don't require expensive equipment or drastic lifestyle changes, but collectively, they can significantly reduce your stroke risk. Remember Margaret, the grandmother I mentioned at the beginning? After her stroke, she worked hard in rehabilitation and regained most of her function, but she'll tell you herself, she wishes she had known about these risks before her stroke happened. She wishes someone had explained to her that simple changes, like how she positioned herself to sleep, could have made a difference. You have that knowledge now. You have the power to make changes before a stroke happens, not after. I know change isn't always easy, especially when it involves habits you've had for decades, but you're worth the effort. Your health is worth the effort, and the people who love you and depend on you want you around, healthy and independent for many years to come. To take this information seriously, but don't let it overwhelm you. Start with one small change tonight. Maybe it's trying to fall asleep on your back instead of your stomach. Maybe it's ordering a wedge pillow. Maybe it's making an appointment with your doctor to discuss your stroke risk. Whatever it is, take that first step. Before you go, I have a few requests. First, if you found this information valuable, and I hope you did, please subscribe to this channel and click that notification bell. We create videos specifically for seniors and their families every week, covering important health topics that can truly make a difference in your quality of life. Second, please share this video with your loved ones. Send it to your children, your siblings, your friends. Stroke prevention is a family matter, and the people who care about you need this information too. Third, I'd love to hear from you in the comments. Are you a stomach sleeper who's going to try changing positions? Do you have experience with sleep apnea or stroke recovery? Your stories help other viewers, and I read every single comment. And finally, if this video helped you, give it a thumbs up. It helps YouTube show this potentially life-saving information to more people who need it. Thank you so much for watching, for taking your health seriously, and for being part of this community. Take care of yourself, sleep well and safely, and I'll see you in the next video. End of voiceover script.